Here's an interesting case from overseas. This man came in from Russia. He had done some root canals over there, and first time I saw him was back in 2002, so about 12 years ago. And this is the case, his picture from his upper right side. He had some root canals and radiolucencies and some pockets. As you can see, this is my old sensor that I just replaced with the new sensor, so I'll show you the difference between this one and the other one. But this is the one that kind of shows what's going on with him. So anyway, I went through my treatment plan as far as redoing the root canal on this one and some perio pockets here, retreatment of number 3 and 4. And I think I just saw him for a consultation at the time, and he didn't want to do anything at the time. So then I lost touch with him till about a year ago, and he came back in January, and he had number 3 or number 2 extracted with the periodontal issues, and he never had the root canal done on number 3 or retreatment on number 3, but he had a long bridge with really bad looking pins and no really good root canal. So this is really not acceptable dentistry. This is just terrible. And he also had not done the retreatment on number 4, and he also had a bridge with a really long post. And so this was a real headache case and confusing to see exactly what we need to do. But he really wanted to save this bridge, and I told him really there's no chance of this happening. Number 3 needs to be extracted, and number 4, at any case, to be able to save the bridge would need an apicoectomy, just because there's no way of taking that big post out. So back and forth to see what we're going to do. His main concern was the bridge, and there was no way of saving that tooth. He had a lot of pockets and decay, and needed to come out, a possible perforation here. So I told him we can do the apicoectomy, so we went ahead and did a apicoectomy on number 4, trying to save the bridge, and this is the MTA. And so that was back in February of 14. And then once I saw him back for a 6 months check, everything healed well, and he had that number 3 extracted with the bridge, and number 4 is saved. Everything looks good, and he was pleased with that work. But if he was pointed to the right direction back 12 years ago, then he wouldn't have all these issues. So that worked out really nice. And as far as the x-rays, you can see the sensor shows up a lot better with the new sensors that I just replaced mid of 2014. These are Check 33 sensors, and it's 5 times better quality as the old sensors. So that works out great.